Now let's discuss the femoral hernia, which is a very important clinical in exam point of view. So what is a hernia firstly? A hernia is any organ that is going to bulge in a region where it does not belong abnormally. For example, in the case of femoral hernia, this is suppose your abdomen and this is your lower limb and this is your inguinal ligament, and we all know that over here lied a femoral ring, and then we had the femoral canal. So the femoral ring is a site of weakness because it allows the passage of an abdominal content into your lower limb. So what happens usually at times when this ring is weak, or in any case where there is increased intra-abdominal pressure, etc., a loop of your bowel or a loop of your intestine, in other words, can easily protrude through this ring and enter your lower limb. And once it enters the lower limb, there is a opening in the deep fascia of your front of the thigh known as the saphenous opening, through which this content can protrude out, and you can actually feel it over your skin. You can feel a bulging or swelling over your front of the thigh in the lower limb. This is known as a femoral hernia, a loop of bowel that is going to protrude through the femoral ring into the femoral canal and out your saphenous opening to produce a swelling in your lower limb. Femoral hernia is more common in females as they have a wider pelvis and they have smaller size of the femoral vessels. Hence, the femoral canal gets wider in females. Normally, this is not going to result in any harm initially. However, with time, if the hernia is not treated, it can prove fatal, and that is because the hernia consists of two parts, the neck and the sac. So what happens is, sometimes what happens if there is too much loop of bowel that is protruding through here, with time, what can happen is that the neck can start to get compressed in the femoral ring. Sometimes it gets compressed to the point that the blood supply to the loop of bowel that is bulging is cut off, and when the blood supply is cut off, that can result in death of the loop of bowel. In more medical terminology, the necrosis of that bulging content, which can result in a lot of pain and can even get fatal. It is a surgical emergency and an immediate surgery should be performed in such cases. So this is known as strangulation, when the blood supply is being cut off due to constriction of the neck of the hernia. When the surgeon carries out surgery on a femoral hernia, what he does is he has to relieve the constriction of the neck, and he can do that by cutting off the femoral ring so that the neck of the hernia has space and the blood supply can be resumed to the loop of bowel. So what the surgeon does is, since we know that the medial boundary of the femoral ring is formed by the lacunar ligament, so the surgeon makes a cut in the lacunar ligament or in the most medial boundary of the femoral ring. However, this is also a huge risk, and that is because in some patients, in some people, lies an abnormal obturator artery in the medial margin of your femoral ring, and if the surgeon cuts and he is not careful, cuts off the lacunar ligament, he can cut this artery as well, which can result in fatal hemorrhage or severe bleeding that can result in death of the patient during surgery. So this was very important to know that there can be an abnormal obturator artery that can be a huge complication in the surgery of a femoral hernia, which should be made aware to the patients. So that was all you needed to know about the femoral hernia. I really hope you understood the topic well. Thank you so much for watching. Do not forget to subscribe to Hasna's Anatomy.